Good afternoon and good morning to you if you are on the West Coast. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health and Public Housing. I want to welcome and thank you for attending today's webinar, Geographical Information Systems to Plan Health Services in Health Center Program Grantees with a focus on public housing primary care grantees. This webinar is being recorded and the resources, slides, and other materials will be emailed to you after the webinar has finished. At the end of the webinar, there will be a question and answer session. I would like to say thank you to HRSA for allowing us to make this webinar possible. Before we get started, I would like to ask all attendees to please complete the post survey after this webinar has finished. Your feedback is really important to us. The use of geographic information system technology allows health center program grantees to identify neighborhood needs and assets, explore disparities in health, compare trends within a geographic region, and prioritize the use of limited resources. This webinar will focus on, but not limited to, public housing primary care grantees and the use of mapping software as a tool to analyze and utilize data to better serve residents in and accessible to public housing. I'd like to get started and introduce our speaker for today's webinar. Joy Oguntimein is a consultant at United Health Group and also the Manager of Health and Research and Promotion for North American Management. She worked with multiple project teams to provide training and technical assistance to CMS. She primarily works with public housing primary care health centers, providing technical, research, and program planning assistance. Josh has had the opportunity to do research with the Health Communications Research Lab at the St. Louis Public School System and the National Medical Association. As a public health researcher, she has covered topics such as health literacy, tailored health communications, health information technology, health policy, mental health, health disparities among the elderly and low-income populations, and school health and wellness. In addition to her interest in public health, Joy is passionate about education and child and youth development. Joy wants to use her diverse background to translate research into health policies, resources, programs, and services in order to eliminate health disparities. The National Center for Health and Public Housing, a project of North American Management, is supported by the Health Resources and Service Administration, HRSA. We provide training and technical assistance to community health centers serving public housing residents. The mission of the National Center for Health and Public Housing is to strengthen the capacity of federally funded public housing primary care health centers and other health center grantees by providing training and a range of technical assistance. These are two examples of maps that have been created by Joy. These maps are depicting PHPCs and public housing developments and health center programs and public housing developments. Joy is going to talk about these maps, how she created, and she's going to give additional information. And now I would like to turn it over to Joy. Good afternoon, Joy.
Good afternoon. Sorry, I was on mute. All righty. And you all can see my screen?
Yes, we can.
Okay. Let me start. Perfect. Good afternoon, everybody, and thank you so much, Jose, for that introduction and for the opportunity to present. To our attendees on the line, just to reiterate what Jose said, this webinar is primarily an introduction to data mapping, and the goal is to give you a taste of the awesomeness of data maps and hopefully encourage you to consider and think about how you can use data maps in your everyday practice. Use it in your health centers or your community organization and your housing authorities, and use data maps to convey data information about your community. And so the overall objective is to help you, and so I want you to feel free to ask questions in the chat box and at the end of this webinar if you have any. The primary objectives are to describe the benefits of mapping health data, to list data mapping tools, explain how to use data maps with the service area competition, grants, and other funding opportunities. Again, my goal is to help you to use data maps, so feel free to ask questions that will make this presentation more useful and beneficial to you. So when it comes to mapping health data, why do we even want to map health data? Like, what is the purpose? Why can't we just stick to tables and charts and graphs? Well, it's because, as we'll talk about, and as you may have noticed with the maps that Jose previewed, data maps help to give us a better visualization of our data. It's just another way to create a picture with the numbers that we have in our data. Sometimes the truth of the matter is that when you're in a rush and you're trying to make critical decisions, the charts and the graphs are nice, but they don't really help you to see the whole picture. They don't help you to understand the context of what is happening where. And data maps can help you do that. With data maps, you take your data, you visualize it, and you can make plans for action. There are many different benefits of mapping, but in brief, the key of data maps is to help us easily and quickly visualize our data, identify where there may be overlaps and gaps in service, to demonstrate change over time, and then to compare statistics and compare different regions and areas. So with data maps, we can visualize health trends among populations and possible influencing factors. We're able to not only map rates of high blood pressure and obesity and diabetes, but we can also map factors that may be influencing that. So we can map park areas and be able to say, you know, perhaps where there are high rates of diabetes and high blood pressure, there aren't many parks. Or we might be able to look at the map and say that where there's a high concentration of obesity, there's also a high concentration of corner stores and mom and pop stores that may not provide full access to nutritionist food. Additionally, if maybe you're a community organization or a housing authority and you're looking to see what your program needs are, you can use data maps to identify what are the needs and what are the assets. You can use the map to say, well, this is where my population lives and these are the resources available. There's a community center, there's a church, there's the community health center, there's the school, there's the United Way Foundation, there's the Catholic Charities. So with the data map, you're able to see what are the needs and what are the assets in the community. Going along also with identifying, you can identify and compare clusters or trends within a geographic region. So you can look at a map and be able to say, well, here in the South we have a high concentration of smoking, whereas here in the North it's not as high. You can compare the difference in the different health trends and the different health trends within different geographic regions. So not just North and South, but even within the North, comparing states, comparing cities, comparing counties. A resource that I really like to use when working with health centers is county health rankings, and it's because they map a lot of their data and they compare counties based on different health indicators, so such as pregnancy rates, high school completion rates, and you're able to look and compare and see where your area is doing compared to someone else. You can also demonstrate change over time. So let's say, for example, you implement a smoking cessation program. You may be able to use a data map to kind of assess whether or not your program was successful. You can map the rates of smoking in your area from 2013 to 2020 and be able to see, okay, yes, we were effective, no, we weren't effective. Maybe we're effective in one area but not so another area. So you can look at change over time. You can look at change over time in maybe obesity rates or diabetes rates, teen pregnancy rates. And then finally, you can compare statistics. Again, this goes back to comparing trends within a geographic region. You can use different symbols on the map. Sometimes you'll have a map that might be mapping the presence of fast food restaurants. And rather than giving you a number or using colors, the symbol, they might use, you know, a burger and a fry, and the bigger the symbol would mean the bigger the concentration of fast food restaurants. And so as we're talking about using using mapping with your public housing residents. Why would you want to use a map? What are the most common reasons? So typically in my experience, when a health center comes to us or another organization and they want us to help them either gather data or give them ideas on how to present the data, it's because they've conducted a needs assessment recently and they want a unique way to display the data that they've collected. Or then perhaps interested in starting a new program, so maybe there's new funding from HRSA or from HUD or another organization, and before they launch or before they propose the organization, they want to see exactly who their potential partners could be, what might be barriers in the community that they're looking to work on, looking to work in, and then maybe they're just looking to make a program decision. So they have their data, they have charts, they have graphs, but they're still having a little bit of difficulty making a decision about whether or not to continue a program, whether or not to start a program. The data maps can help that. Here on the screen you see this data map, and this was from a needs assessment that was done. And the goal was to display the resources of the community and look at what's available, where there may be overlap, where there may be gaps in service and unmet needs. And so you have the site legend right here, and the hand shows basic needs. So this could be a United Way organization or your Catholic Charities type of organization in the area. And then you have education, so the different schools that you have, healthcare. And by looking at this map, the person can see, oh, you know, there's schools over here, but there isn't a health center maybe. And maybe in this community, transportation is a challenge. So they may be interested in starting a school-based health center over here because there isn't necessarily a health center close by. Or they could say, wow, there aren't really a lot of mental health resources. We have one smiley face here and part of one here, and they might have additional data that says that mental illness is a big issue within this area. Well, then this map helps them see, okay, we need a mental health, we need to provide additional mental health services here. So that's where you would use MAP, again, to see what the assets are, what the barriers are, where there might be overlap, and where there might be gaps. Because sometimes when you're starting a program, you don't want to start from scratch. You may just need to partner with somebody. And with the map, you're able to see, who are my potential partners? Who can I reach out to for this? And so now I want to go through and show you some resources that we've used here at North American Management, and resources that you can use to generate maps, whether it's for your grants, whether it's for your board, or whether it's just for you and you want to get a better understanding of the community that you're working in. So the first one is Community Commons, and I really like Community Commons because what Community Commons does is that if you don't have your own data, Community Commons already has a database where they've collected, data from CDC, HRSA, HUD, the Census Bureau, and a wide variety of federal sources, and they put them all in one big data, and you just kind of search for what you're looking for, and they create the maps for you. Right here on the screen is a map that we've used when we were working with older adults, and we wanted to understand food insecurity. And so what this map shows is food insecurity, and this is in Arizona. And so the colors kind of show you what the percentage is of the food insecure population that's not eligible for SNAP, the Supplemental Nutritional Program. And so this might be useful to you, again, if you're looking to start a new program that addresses food insecurity. Maybe you want to partner with Meals on Wheels. This kind of map would show you where you may want to target your services and where there's the greatest need. I'm now going to switch it over to the internet. Hopefully I won't have any problems to kind of give you a step-by-step guide on how you would create a map in Community Commons. These instructions are included here in the webinar. So after the webinar is over and the presentation is disseminated, feel free to come back and look through the instructions step-by-step and play with creating your own map. So, okay, perfect. So to start off, Community Commons is a free resource, and so I've already logged into my account, but you could easily, when you come here without logging in, let me see if I can open a new window. There we go. You can create your own account your own free account to use for your organization. Oh, it logged me in here also. But you can create your own free account. When you've done that, you want to go to Maps and Data, and then select Make a Map. And as I mentioned before, Community Commons is really cool because it already has data in there for you. So you just kind of search for what you are looking for. So let's do the food insecurity one again. Food insecurity. You search, and as you can see, I have 43 different results, and so I have to kind of skim through and find out exactly what it is that I'm looking for. And so food insecurity is a broad topic, and so it's giving me, families receiving SNAP, and it's broken it down by families, Hispanics, households with children, households with seniors, married families, minority households, unemployed families. It's also giving me, let's see, what else? Food insecure children that are not eligible for SNAP. It's giving me more of unemployed families, the food insecure population, and more. And one thing to note that may help you decide which data to use is that after it tells you the title of the map, it tells you the source, and you're allowed to get more information. So this is Feeding America, which I believe is a nonprofit, and this is data they collected. Whereas with this one, this was created by ACS, and this the American Community Survey, which is distributed through the Census Bureau. So you can decide which resource that you want to use and which data actually captures what you're interested in. So for this, let's just go ahead and look at children. I'm really interested in children. So we're going to look at households with children receiving SNAP, and this is data from 2010 to 2014. And that's something to note. The most recent data will always be listed first. So if you notice, it says 2010, 2014, 2009, 2013. So depending, again, on the purpose of your data, that may also influence which resource you decide to use. So you select the record that you want to use, and then you select Add to Map. And then also to point out here on the left-hand side, you can see that you can sort by the relevance, the release date. And then if you really want to narrow it down, you may want to look at it by state. Sometimes they'll have state data or county data. Again, Add to Map. And voila, we have our map. And you can see here that we have the legend telling us what the different shadings mean. And then here, where it says enter a location, you can again now narrow down into where you're looking to, of what geographic area you're most interested in. So just for fun, let's do New Orleans. Type it in, select, and it will zoom down into that area for you. And you may want to, you might have more particular data, so you can look by parish, or you can also type in zip codes and ZICTA, but then whatever you type in here, it'll zoom into that area for you. So again, you can just play around with it and look and see, compare the different areas, look at the different shading. You can select the area, and it'll give you additional information. So we selected Carrollton, so it tells us what parish, the state, the parish it is, the actual number that we may be looking for. So 36% of total households with children receive SNAP benefits. And just the total household, so it also gives us the number, and so additional information that we may be interested in. You can save your map by clicking here and pressing save. And when you save the map, what it's saving is your current screen. So as you can see here in the left-hand side, it's only saving the area that we zoomed into. You can give it a title, a description, keywords, and tag, what it falls under, whether this is health-related, food-related, equity-related, and then you're also able to share it with the public. part of why the site is called Community Commons is because it's a bunch of people sharing maps, some that they've created using their own data, maybe maps that they've created using federal data. You can also, once you have it, export it as an image file or a PDF document. Again, give it a title, and you can decide the layout that you want. So that's Community Commons. Again, the step-by-step instructions are available in this webinar. So moving on to UDS Mapper. I know that many of you are probably familiar with that, using it in your service area competition grants or when you're applying for different services. UDS Mapper is a great resource if you, again, want to understand a better layout of your land, and more so in terms of socioeconomic service, insurance status, and those type of topics. So we're once again going to go back to the internet. Go to UDS Mapper. I've already logged into my account. Again, UDS Mapper is another free resource. So when you go to udsmapper.org, you'll be able to sign up for your own account. And so when you get to UDS Mapper, you enter your geographic region of interest. Let's say I'm going to put in an Indiana zip code, 46315, which is Greencastle, Indiana. And I can zoom into that particular area, as you see here. And then we want to tell UDS Mapper what it is that we want to see on our map. Is it the administration locations? Is it the service access points? Is it the NHSC sites, rural health clinics? Whatever you're interested in, you just select it. And again, what we found is that this type of map is really useful for those looking to expand services or just starting a health center, because you're able to see, again, what is already going on in that community, what services, health services, are already available to your target population. So we're going to be interested in the health center service access points. And then you want to select what is your main base map going to be. And we want to look at UDS data, so we select that. And we're just primarily looking at grantees. And then you can select, again, for your base map, as I mentioned earlier, you can look at insurance status and kind of income. So we want to look at low income not served by health centers, because let's say we're a health center looking to do an expansion. We put this, and so it's not shown. Let's zoom out a little bit so we can see. There we go, that's better. And so your legend shows up at the bottom of the screen. And so each dot represents 100 people that are not served by health center grantees. But since we don't have a lot of dots, that tells us that many of the low-income people in this area are served by some type of grantees. If we were looking, let's see if we can go back to all 50 states. There we go. And then zoom in a little bit. We can search the map for areas that may have lots of dots and that tell us, okay, there's a significant population that is not served by health center grantees. And also, as we zoom out, we can better now see these other legend marks, so the health center service access points and look-alike points, and we can see where they are. Just want to be able to give you all, I'm going to move it a little bit so you can see more of the U.S. of the map. And so again, UDS Mapper is a really great resource if you are for your service area competition grant applications, because you're able to include these maps to show that there is a need for the area that you're looking to expand to. there go our dots. I was wondering where they were. And so the dots now show up, and you can see where there's a huge concentration here, like in Michigan, and here in Michigan where there's a lot of people not served by Health Center grantees. So these could be target areas to expand to. Let's zoom into Michigan so we can get a better view. There we go. And so as we zoom in, the dots don't look as clustered, and so again, we get a better perspective of what may be some target areas. So even though we've zoomed in, we still see that there's a good cluster here, there's a cluster here, and there's a cluster here. These might be areas to consider expanding to or opening up a health center site. You can also go, again, from not low income, but you can look at uninsured, not served by health centers. And the same clusters, not surprisingly, kind of show up in the same area. So these, again, can indicate target areas where there is a need for a PHPC or a homeless grantee or just a overall community health center. And then finally, the last resource that I want to show you all is ARCGIS. ARCGIS, unfortunately, is not a free resource, but if you do have money in the budget and mapping is definitely something that you see yourself doing on a regular basis, I would highly recommend ARCGIS, especially if you have your own data. ARCGIS online, it does take some learning, and there are courses that you can take, but it is not too complicated, and there's some really interesting things that you can do with that. I won't be able to show you everything today because this is an intro, but maybe in the future we might be able to do a more in-depth ARCGIS webinar, kind of showing you all the different things that you can do with it. So going back to the internet, let me see. So this is the ARCGIS home site, and from here again you can sign up for a subscription to ARCGIS online. When you do and you start making maps, when you come here in the future, all your maps will be cataloged in one area. These are all the maps that we've made in the last couple of months. I want to show you one. We were talking about using maps to show assets. This map, entitled Assets Among 3 Diverse Public Housing Communities, was a map that we did based on the area that we are in now, Alexandria, Virginia. And what we did was that we chose public housing sites in the area, and we just wanted to know what resources are available to the public housing residents in that community. Because as we all know, for those of us that work with public housing residents, they have multiple needs. And so it's not just a health center that they need, but they might need a health center and a drug counseling site. They may need a health center and a food bank. They may need a health center and an organization that offers parenting classes or job training classes. And so we want to know, what are the resources available to residents in this community? So here in this map, you'll see the star, which represents a health center, and then these dots represent the resources available. And I know you're wondering, well, how are we supposed to know that? Well, because you're not, because we didn't put the labels, and I'm going to show you how to make the labels. But let me back up and show you how we made the map. When you're doing maps in ARCGIS online, again, this is an intro, and you can probably get a better idea if you go to the ARCGIS training course or if in the future we do an ARCGIS webinar. When you have your data for ARCGIS, you create it in an Excel file. And from that Excel file, you're able to upload it when you go here and say add layer from file. When you do that, that's where you begin to get these dots. Once your data is mapped, you can go now and then create labels to label your information. And so we create a label, and so it's giving us the label for the housing development, Andrew Atkins. And now for labeling the resources. So if I'm a health center and I am looking to expand, I can use this map to see what's already there. They have a recreational center. They have a fire department. There's a park. There's urgent care. There's a preschool. There's a counseling and empowerment center. So all of these are resources and potential partners that I can work with to serve the residents in this community. Again, this isn't just for health centers. If you're not a health center, like, well, what about me? Again, if you're doing any kind of program, whether it's with public housing residents or not, using map data can help you look at who your partners can be. It can help you see if there's overlap and where there's gaps to give you a better idea of what you should do and who you should talk to before you do it. As I mentioned earlier, I know that many of you all use the UDS mapper for your service area competition grants because that's part of a requirement. But you may now want to consider using Community Commons or ARCGIS to add additional data to strengthen your point and to make your proposal stronger, to show the need. Let's say you're interested in not just opening a new site, but you want this site to focus on heart health. Well, then you may want to add a map that shows maybe what the heart rate, the high blood pressure rate is and heart disease rate is in the area, and then kind of show maybe over time, if it's a program that you've done in the past, show how when you implement your program what the improvement could be. This is all stuff that can be demonstrated in the map. Other available data sources that you can pull data from if you're not conducting your own needs assessment, if you don't have your own data that you want to map. There's the American Community Survey, which we talked about briefly with Community Commons. There is the HRSA Data Warehouse portal, and there's the Census Data Mapper. All of these resources, you can get to these resources by going to our website, www.mphc.org. And so in conclusion, mapping is a great tool. When you use data mapping, it helps you with planning, it helps you with implementing your program, and it helps you to assess your program. Using data mapping can help strengthen the work that you do. It can help you identify the needs and identify what kind of programs you need to do. It can help you to target your efforts as you're implementing, and it can tell you if what you're doing is working, as you can use the data to assess and monitor change over time. That concludes the presentation, and we are now open for questions.
Thank you, Joy, for this wonderful, very, very descriptive presentation. If you have any questions, please submit it through the question box on your control panel or use the hand raise icon and your line will be unmuted. Thank you, Joy. We received one question. This is regarding ARCGIS. Do you know what kinds of layers or health data can you add to a map?
The question is, what kind of layers and health data can you add to a map?
Yes.
You can add just about anything with ARCGIS. So, excuse me, with this current map we showed you resources, but you can also show maps with population density. So if I wanted to come here, you can add, similar to Community Commons, ARCGIS does have data available already that you can add on your own. So you can add population density, you can add heart health data, you can add weather data, you can add transitions from, you can maybe create a map that shows people transitioning in and out of public housing. The thing with ARCGIS too is that you can add multiple layers to one map. So you may want your base map to just be a population map that shows the general population. And then you might want to add another layer that shows housing within certain developments. And then you might add another layer that kind of breaks down the types of housing. Does that answer the question?
I believe it does. Thank you, Joy. Thank you very much for your response. There is another question here. Are you familiar with other data resources that we can use to get information on other special populations?
Can you ask the question again, please?
Sure. The person is asking if you are familiar with other data sources or resources that they can use to map other special populations.
Yeah, so there's of course Community Commons, ARCGIS Units Mapper that we mentioned. I think I also mentioned county health rankings. That's another really great resource that you can use. UDS, not UDS, HRSA's Data Warehouse Portal is a great resource. There's the UDS portion, I'm trying to remember the actual name, but there is a, here it is, let me, maybe, I think I have that. I want to show it on the screen if I can. Here we go. Can we switch to my screen for a quick minute? Here we go. So on HRSA's website, if you go to bphc.hrsa.gov, there's also data resources you can use. So Health Center Program data, you can go to any state and essentially look at the data for any health center. You can also go to the uniform data system where people, oh no, not this one. The UDS Mapper, as I mentioned, and so you can look at the different, so HRSA also has data available for people to look at.
Great, thank you, Joy. And one last question that I see here. Does HUD have data on public housing residents?
Oh, yes. Let me see if I can find it. There is, HUD does report and allows you to see not just the number of, here we go, resident characteristics report. I believe this is the right side. I will send this to Jose to look to get the proper, here we go. And so it's called the Resident Characteristic Report. This is the link. As you can see, it's not the easiest to get to, but you can look for public housing data on any one of these labels. So if you know the agency that you're looking for, Colorado, Denver, report. Is my screen still showing?
Yes.
Okay, I just want to, so you can see here is the resident characteristic report. So you can see the number of units. It gives you income data, race and ethnicity, information about the household. So is it female-led? The age of the people living, the age of the household members, how many bedrooms, and then also length of stay, how long have they been living in public housing.
Great, great. This is really good, Joy. Thank you for this resource. And I don't see additional questions, so I would like to thank Joy for this wonderful presentation. And to all of attendees, please complete the post survey. This helps the National Center for Health and Public Housing to improve our webinars. If you have any training,
sorry, Jose, we do actually have one more question that just popped up as you were saying that. It's for Joy.
I cannot see it. Can you please read it to Joy?
Of course. I am wondering if there is a list or matrix of data mapping resources available that can be used for health centers aside from these three.
So a list of resources. You know, that's a great question. I'm on the website now. I thought we had So there is not, but that is something that can be created. And a resource that would list, again, Community Commons UDIS Mapper, but then also some of the other resources that I mentioned, American Community Survey, Census Data Mapper. I know CDC also has some data that they have pre-mapped that you can pull from that gives you health data. So we can create one and put it on the website and disseminate it through the weekly digest. So if you're not signed up for the weekly digest, go ahead and sign up for that, and that'd be a way to get information once it's available.
Great, thank you, Joy. Any other questions on your end, Brandon?
No.
Okay, great, thank you. So to all of attendees, please complete the post-survey. This helps the National Center for Health and Public Housing to improve our webinars. And if you have any training or technical assistance needs, please contact any of our staff members. Also, please visit our website, www.nchph.org. You will find webinars, monographs, fact sheets, training manuals, newsletters, information on our annual conference, and information on our one-on-one training and technical assistance. You can also join our mailing list and receive HRSA updates, Medicare updates, information on funding opportunities, information on senior programs, and other resources and services. You can also find information on our webinars, and you can also follow us on Twitter, on social media. You can also subscribe on our YouTube channel. So once again, I would like to thank you very much for attending this webinar, and thank you to Joy. Thank you and have a great afternoon.